So were we lonely before the pandemic? So in 2018, there was a Cigna study that said 50% of the country's adults were lonely. And then by 2020, we're at 61%. And there's another study, there's always studies, but there's that some people are going to have one trusted contact to even just share basic things. And that in and of itself is kind of scary, because if you don't have a friend, if you don't even have a family member, if children are going to school and feeling like they can't talk to anybody, that kind of breeds fear, because they're starting to feel like, if I'm never going to have a friend, why college? Why would I do this? Why would I participate? Because that social isolation that tends to come from it, like I said, the fear that comes, you don't really want to participate. And we have to look at it individually. We can't just always say, oh, just get out there. If you see that a child is struggling, you have to stop and figure out if they need some help or if you can help them yourselves. But it starts with a conversation, and it starts with asking questions, reasons, and talking to children about grief. I had a lot of questions on this, and, we have to be careful when we're answering, like for the group. If we were in person and I could just speak to you, it would be a lot different. And that's one of the things that I miss about after doing presentations. You're able to just stop and talk to people and really get that support going. And, even to be able to hug. But guess what? We can't do that right now. So this is the next best thing. And, as long as we stay connected, we'll be able to look outside of this, and we're going to be able to come together. But in the meantime, we have to figure out ways to discuss things. No one can tell you as a family how to tell your child about death and dying or loss. It's something that you have to come up with on your own, but you do need to have the discussion. So if a child has never even seen a goldfish die, by the time they get to maybe, heaven forbid, a grandparent or somebody close passes away, it doesn't seem real. So when you talk to kids about grief, it has to be age appropriate. How you speak to a 5-year-old will be different than how you would speak to a 16-year-old. The younger children tend to think that the person is going to come back. They think it's temporary. And that's why it's I hate to say it, but it is good, if, children have pets or have something that they actually lose, so that you can explain to them, and then they can live life and see, okay, it's not coming back, help them process. And then by the time they get to a person passing away, they at least have some introduction as to what death is. And allowing them to ask questions, that's the biggest help that you can give them, because sometimes you can imagine that they are going through X, Y, and Z, and it's not that. And so you want them to ask you questions, and you answer as appropriately as you can, but, and as honestly as you can. But like I said, it needs to be age appropriate. Not talking about death is one of the worst things you can do with children, because, it's unrealistic. Just as we have life, we have death. We don't like it. We can't stand it. But right now, especially when kids are seeing so many loops and feeds, talking about death and talking about COVID and possibilities and all these different things, it's scary. So we do need to have conversations with them, and we need to talk to them about safety. How can we keep each other safe? It's so funny to go to the elementary school and see the little kids, and, they've told them about washing their hands and about, like not touching each other and, like not touching each other's toys and these different things. And they'll follow rules better than some of the older ones. The older ones, we feel like, oh, we don't need our mask. We don't need to do this. No, we do need to do these things, and we need to model the behaviors for them. There's not enough support, or you just don't feel like you can talk to, you're not reaching the child like you would like, or they're just not progressing. Grief counseling is always really, really good. It's not something that they have to do forever. Most of the time, they usually only need a few sessions, but they need to figure out a way to process the emotions. So what can we do moving forward? Identify the emotion. So I've noticed that a lot has come through, and a lot of people that I deal with are worried. They don't really know where it all started. Most people had something going on before the pandemic began, whether it was problems within the family, whether it was death, and you lost some people, and now you've got COVID, all these different stressors that we did not have over a year ago. But now it's everything. We don't go during the word COVID. So identifying your emotions. If you are angry, you need to acknowledge it. There's nothing wrong with being angry. How you handle your anger is usually the problem that people have. It's like, because I'm hurting or because I have high anxiety, and especially in certain communities, anger is usually just anxiety, but it is displayed in that way. And people don't understand it. It's like, well, sure, everybody goes through something. Sure, everybody gets angry, but no, when it's sustained and it's interfering with your day to day, most of the time you need to see someone. And there's nothing wrong with that. And like we were just talking about, how many people are struggling and unable to speak to anybody because they don't have any close contacts. That's why we have therapists. Most people are like, why in the world has therapy just, like now it's everything. And it's not just that. Most people and have needed to speak to someone. It can be a checkup or it can be a full on, you need regular sessions. But guess what? If it helps you progress in life, I think that is one of the better things to do. And trying to understand your feelings. So not putting them under the rug and really realizing, hey, I do feel bad. I am hurting. I'm hurting others. Others are hurting me. It's okay to identify it. And guess what? Take initiative. Educate yourself, like we talked about last time. But if you need to speak to someone, you need to cry, you need to let it out without judgment. Speaking to someone that you care about, that cares about you and that you trust is great. Seeing a therapist that you identify with, that you feel like can really help you is wonderful. But at the end of the day, we do need to get help most of the time, and we don't want to ask for it. And we have people even sometimes around us that are willing to help us, and we'll say because out of pride. And sometimes we have to let those things go. So feeling the emotion, taking the initiative and all that is great. But guess what? You got to take those action steps. And that's part of the initiative. And that's part of what is happening now. You taking the time out to listen to or watch these seminars, it is a gateway to help you move forward. So with all of this, every person has been affected, whether it's in a positive way or a negative way. I've seen people have financial gain, hope in even during this pandemic. But when you've lost so much, seeing other people do better or whatever else, you can't even imagine yourself moving forward in your life right now, let alone trying to look at, okay, I'm going to have hope for the future. I've lost so many people. How can you even begin to say that? And I saw that in a lot of the questions, and I acknowledge that. And people being dismissive and saying that you should just move forward and move on. That seemed to be the running theme. That's not something positive. That's not necessarily the type of people that you want to be around, even when you're going through something. You want to be around positive people. You want to be around people that are going to help you grow, that are going to help you heal, because at the end of the day, so we're in this shared experience. Every one of us has experienced some kind of loss with this, but for the people that have done really well or haven't had any physical losses, or they haven't lost any people, they are the ones that sometimes can help lift you. But if you don't have anybody in your life, you really, really have to get out there sometimes and figure out, am I going to be okay? If you can say yes, that means you're still here, you're ready to get back in the game, but you still need help. Asking for help, locating a therapist, joining a support group, all of those things are wonderful tools, and they will help you move forward with what you need to do and helping you get through this experience. And it's not something that you'll ever get over. We move through it, and we want to do it in the best way possible. And we want to have hope. We shouldn't think that COVID is going to be here forever. Right. So, I think we can spend, like 30 years living one way. We live 1 year of a horrible year, and we're like, it's never going to get better. But we have to participate in this and say, yes, it's going to get better, and we're going to do it together. And so community and support. I know a lot of people have said that, like during this time, they haven't felt like they have any help. But if you search out resources, a lot of times you can find them, whether it's the city or through faith-based organizations, through different little community outlets. We have to actually look for them. There are a lot of times, they're just not going to send them to you in the mail. So unfortunately, we do have to participate in that way. But, I notice a lot of times people are like, well, I want to go to therapy, but I don't want to sit in an office. A lot of therapists are seeing people virtually, and I am too. And I've found much success and looking at how clients move forward and their resiliency, even through all of this, has encouraged me. Because when I speak of all these multiple losses like you guys have had and you've sent in your questions, a lot of my clients have experienced the same thing. A lot of colleagues are saying some of the same things, but we're in this together and we have to look for ways to support one another. So my last thing, bees need a hive and humans need a tribe. Somehow we have unraveled and we want to be scattered and we don't want to be a tribe. Everybody needs their tribe. I don't care if you've only got 2 in your tribe or if you've got 10. You need good, healthy people that aren't there to hurt you, there to help you, and can kind of come together and figure out support either someone that's lost a lot of people or somebody that's lost one person. You have people that are dealing with, like I said earlier, with infertility, miscarriages are really huge right now because of the stress level that's going on. They're feeling like, I'm kind of left out there. Everybody's talking about COVID, but, I'm experiencing this type of loss too. And I say to those people, it's best to try to locate a therapist. So I'm going to address a few of the questions that came through previously, and then I'll get into the questions that we have right now. One of the biggest things that I think gets kind of lost, and I kind of touched on it earlier, is people using different negativisms. So whether it's overeating, addictions can go, in a lot of different ways. So, we tend to look at drug use and alcohol abuse as the main ones, and they're really, really difficult to deal with. But we have to look at how are we taking care of ourselves? Because in and of itself, us staying at home and eating and not really moving enough has caused different problems as well. And when we don't get fresh air, when we don't take the time out to even go outside, we isolate and pick up different things. And so if drugs are an issue, it's better to see someone, address the issues as well as, so you need someone that deals with both, with alcoholism or drug abuse, as well as any kind of mental health issues. Because when you try to take care of one without the other, it usually doesn't work. You have a lot of people that try to go in and like, I'm just gonna quit drinking. And, if there was a reason why you picked it up, we want to get to the underlying factors so that you can move forward and not really continue in the same way. And another thing is with trying to deal with family with all of the multiple losses, people are saying that they're having a hard time even talking to family members. And there's been a lot of, infighting. And I get the question, like, what do I do? And it's really complicated to just answer, just one answer because every family situation is different. I would say seek support, because if I just tell you one thing and you try to go with that and it does not fit your family pattern, it's not good advice. It's something that, like if a friend told you to do something and then you did it and you're like, that was horrible, but it was your decision to try to implement it. But as a professional, I can't necessarily tell you, like without sitting down and knowing what the whole situation is and letting you process how you would like to approach it. It never should be my idea. It has to be supported. An idea that we use and you kind of support you through it. And another thing that people were saying is that they have a lot of guilt as they are still here and their loved ones are, some of them are gone, like I said, those multiple losses, and wondering, how to move forward without it. But yet, their life was spared and they're wondering, what do I do? And that feeling of guilt. And even if, say a person is the one that gave somebody else the illness, or they think they did, that is difficult to deal with. And I would definitely say, see someone.
That